two major types of micronutrients, where we discuss about either minerals or vitamins. So let's start with minerals. So what are minerals? And why do we need minerals for day-to-day life? How important they are? So always since the nutrition science has evolved, we are talking about that yes, minerals or micronutrients are very important, but at the same time, although being very important, they lag behind. Most of the time we will have micronutrient deficiencies in many form, especially in the form especially like if we see nowadays, most of the COVID patients, those who have recovered from the COVID, they will have vitamin D deficiency, or even though those who were actually who were the people who were highly prone to COVID, they were it research shows that the most people who were suffering from micronutrient deficiency, they were highly vulnerable to catch COVID because of low immunity. And minerals are the nutrients, vitamins are the nutrients which helps in boosting our immunity. So mineral nutrients are most traditionally divided into two: macro minerals and micro minerals. What are macro minerals? Any mineral which require more than 1 milligram, sorry, per day, and micro minerals which requires means less than 15 milligram, 1 to 100 or less than 15 milligrams per day, they are micro minerals. If we see how much minerals are present in our body, so near about 2.8 to 3.5 kg of our whole body weight is made up of minerals. Out of that 3.5 kg, approximately 50% of the weight is of calcium, our bones. Another 25% is phosphorus, and out of that 50%, almost 99% of the is calcium, and 70% of it is phosphorus, which are found in bone and teeth. Okay, apart from that, we have other 5 essential macro minerals, which are magnesium, sodium, potassium, chloride, and sulfur. And the 11 established micro minerals, they are required in very less quantity, that is iron, zinc, iodide, selenium, magnesium, fluoride, molybdenum, copper, cobalt, boron, which can constitute near about or remaining 25% of the total mineral content present in the body. Then there are some ultra trace elements without established essentially for the human, but they are sometimes found in human body, and they are arsenic, aluminium, tin, nickel, vanadium, silicon, which provides which is actually not required, but sometimes they are traceable in human blood, and that is a very negligible amount. Okay. So macro minerals exist in the body and foods chiefly in a ionic state. For example, sodium, potassium, calcium, they will exist inside the body in positive ions in the form of cations, whereas other minerals exist in the form of anions. Okay, and there are few others like chlorine. They are there in the in body. They are in form of chloride, sulfur in the form of sulfate, phosphorus in the form of phosphates. And mineral also exist as a compound of organic compounds, like they will do relationship, they'll establish relationship with some macro minerals, for example phosphoproteins, phospholipid, metalloenzymes, and metalloproteins like hemoglobin. Okay, so coming to the each mineral and their functions and their deficiencies. So potassium, main function of potassium is to maintain electrolyte balance inside our body. And potassium's food component which are rich in potassium are potatoes, squash, spinach, broccoli, carrot. And what happens when there is a lack of or there is a deficiency of potassium? Person will feel weak, anorexia, muscle weakness, muscle cramps will be there, and prolonged diarrhea can be seen in the person who is deficient in the potassium. Calcium, another very important mineral. This is main function is to form as well as maintain our bone, our teeth, and also supports in the blood clotting. And what are the rich sources of calcium? Ragi, milk, yogurt, and fishes like sardine, and other than fishes, tofu, green beans, spinach, broccoli. So these are the rich sources of calcium. What happens if there is a deficiency of calcium? Rickets in children, osteomalacia in adults. Other than that, there are many other associated disease also which occurs due to the deficiency of calcium. Phosphorus. So phosphorus, as we know, calcium always comes with the phosphorus. They're like friends. So phosphorus is equally important. The main function is the formation of cells, bone, teeth, and the maintenance of acid-base balance. What are the main food which are rich in phosphorus? Meat and meat product, poultry, egg. And what happens if there is any deficiency of phosphorus? Weakness will be there. There will be a pain in bone, and a person may feel anorexic as well. Iron, main function is it is a part of protein also. So hemoglobin, which carries oxygen throughout the body, and the rich sources of iron are any food product which are being cooked in a proper iron vessel. Apart from that, natural products, there are green beans, tomato juice, and meat products. Apart from that, spinach, broccoli, parsley, such kind of leafy vegetables are also rich in iron. Deficiency of iron, there are a lot of deficiency which is well known, like anemia. Apart from that, if anemia is there, definitely weakness, headache, fatigue, such things will be, shortness of breath. So such things will definitely be there because of deficiency of iron. So initial stage, what happens, when person starts getting anemic, earlier anemia was anemic, the initial signs and symptoms are headache, fatigue, weakness, these things. There was a time, means long back, maybe 5 years ago, anemia was the major problem in women only. But nowadays, recent study have shown that now men are also falling in the category of anemia, or they are also deficient, they are also highly deficient, they are found highly deficient in iron. And they were the people who were having or who were consuming more and more alcohol. So somewhere actually alcohol is inhibiting the proper absorption, proper metabolism of iron inside the body. Okay, coming to the next, that is zinc. Main function, zinc, zinc is very much essential during pregnancy for the cognitive development of the child. Apart from that, it is a part of many enzymes. It also helps in the transportation of vitamin A. It also helps in the taste perception, wound healing, sperm production, and normal development of fetus. So, what are the significant food which are rich in zinc? Are spinach, broccoli, green peas, and yogurt, Swiss cheese. Not only Swiss cheese, Indian cheese are also considered to be rich in zinc. What happens due to the deficiency of zinc? There will be loss of taste, there will be very slow healing of wound, and there will be retardation or bad cognition in young children. Selenium, although minerals like selenium we just ignore somewhere, but selenium is one of the important mineral which actually works a lot especially in treatment of diabetes or in treatment of cancer, which I'll be discussing about further. So they acts as antioxidants. They works with vitamin E to protect the body from oxidation. And major source of the selenium is grains, meat, or seafood. Seafoods are highly rich in selenium. Impaired thyroid function can be seen due to the deficiency of selenium. Impaired cardiac function can be seen, as I told you, selenium is very good. Selenium nowadays researchers, lots of researchers are going on which says that selenium is highly required, or supplementation of selenium prevented the disease like chronic heart disease and all. The necrosis of liver, enlargement of heart, all such problems can be seen if there is a deficiency of selenium. Coming to next, iodine. We all know iodine is, if especially some parts of Rajasthan and the parts of Bihar, Bengal, Orissa, these are few states where there is a deficiency of iodine, can be seen very easily. Why? Because of more consumption of rock salt and less consumption of iodide fortified salts. And goiter is highly prevalent, and the main function of iodine is to regulate our mental health, regulate thyroid hormones. And if these things does not if these things are not functioning properly, means there are deficiency of iodine. Although iodine cannot be in its form normally or naturally in the nature, so it is always better to fortify iodine. And after lots of research, it was found that salt is the best food product where iodine survives for the in its original state for a very long period. They have during the fortification research, they have tried to fortify iron in a wheat flour, in a rice flour, or even maize flour. Because why do we do fortification? We do fortification, or especially we choose any staple food. Most of the time we choose staple foods for the fortification. So it was a headache for all the governments that why in which food product iodine should be fortified. And after lots of research, it was decided that or iodine remains in a good state in salt even after the cooking also. So iodine is being fortified in the salts. And seafoods, they are naturally present in a good amount. Then bread, milk, cheese, so such things are there which are the good source of iodine. Coming to the copper, necessary for the absorption and utilization of iron, supports the formation of hemoglobin and several other enzymes. Copper, meat or water which is kept in a copper vessel and being used for the drinking purpose is always rich in copper. And deficiency is rarely seen in adults, but infants develops anemia, and nerve tissues and lung problem can be seen due to the deficiency of copper. Coming to magnesium, magnesium supports mineralization. Magnesium also helps in building protein building, muscle contraction, nerve impulse transmission, immunity. Magnesium is rich in spinach, broccoli, green beans, then sunflower seed, cashew nuts. And it is very easy to get magnesium in locally available food approximately all across the world. What happens with the deficiency of magnesium? Most of the time, nausea, irritability, muscle cramps, twitching, cardiac arrhythmias can be seen in the magnesium deficiency. So these are most of them are symptomatic, but which can lead to a major illness in a long run. coming to the, let's discuss that what are the metabolic disorders which actually can be prevented or can be managed with the minerals. Okay, there are like liver disease or kidney disease or disease any related to heart or pancreas. These occurs, many researchers have shown that from the diet, even cancer can be prevented if good amount of mineral is being consumed. If somebody is at pre-diabetic stage, consuming good minerals, it can be reversed at pre-diabetic stage. If person occurs diabetes, there are some research findings which say that they did weight loss, just increasing the amount of minerals in their diet and just letting them complete, just fulfilling the daily requirement of minerals in the diet. Diabetes can be managed easily. So let's see this. Diabetes mellitus, it's a disease marked by high levels blood glucose resulting from defects of insulin production, type A diabetes, and then insulin sensitivity, that is type 2 diabetes. The symptoms of diabetes include weight loss, polyuria, polydipsia, polyphagia, and diabetes represents approximately 90% of the all patient. Type 2 diabetes represents approximately 90% of all the patients with the diabetes. So we are having more diabetic people with type 2 diabetes, and risk factor for the type 2 diabetes are like age, genetics, ethnicity, obesity, and so on, various other factors. Type 2 diabetes is a progressive condition which generally begins with insulin resistant and an initial compensatory. Long before there was a biochemical evidence, some researchers which shows that there were biochemical evidence for the relationship between zinc and insulin in the beta cells. It was clear that addition of zinc to the insulin would change the time course of the effect of given dose of the insulin. So what happens, sometimes there are many people, not like patients, especially those who are diabetic patient, if we will talk about their psychological status, what happens, some will be like, I'm okay with the medicine, okay, I'll take insulin and things will be fine. But if doctor has prescribed them a multivitamin or a mineral tablet, capsules, they will, or capsules or any mineral syrups, they will avoid consuming them. Then there will be a different drug reaction. There will be different drug reaction inside the body. If it is being consumed with zinc, it is being given with the zinc, definitely that will give some different effect on the diabetic people. But sometimes we as a healthcare worker, we as a health care member, we because of lack of communication or because of having more and more populated diabetic population inside in our country, we miss describing such things. And I have I have done research on diabetes, so I have experienced that there people after 4 or 5 years, old diabetics means those who are already diabetics from last 5 year, 10 year, 15 years, so they are very much comfortable now with taking insulin or the metformin, what they are taking as a drug. So but other medicines, other diet management is always with the medicine. So what is that diet management? There they should take care of, or being a healthcare personnel, we should take care of the diet which should be rich in some minerals which can react nicely with the uh, drug, okay, whatever the drug they are consuming. That's why food drug interaction is very important, how our food is interacting with the drug. There are some food which will inhibit the drug. There are so many malpractices, especially those who are living in homes, not in the hospital, and consuming daily basis medicines. They'll have very bad malpractice, or they do malpractice with the food and drug. Just after having food, it's not required that people will have food and then they will, just after that, they'll give the medicines. These are then the food drug interaction becomes sometimes some food we consume, we don't know, as a patient don't know that food may inhibit the proper absorption, proper mechanism of that particular drug inside the body. Similarly, if we are taking some, that is adverse effect. But what is the good relationship? Good relationship means if somebody is consuming taking insulin, injecting insulin in themselves, then if they start eating good amount of zinc, good sources of zinc, definitely insulin will give more clear picture in their treatment. Okay, coming to the next, there are several studies which suggest that the role of chromium supplementation is really good in the management of glucose intolerance, gestational diabetes, body weight, and corticosteroid-induced diabetes. Chromium supplementation did have beneficial effects on glycemia as well. Then, according to recent FDA statement, there is insufficient evidence to support that chromium supplementation is actually works for the patients of diabetes. But there are many papers which supports that if they just provide the daily required intake, means daily required quantity of chromium, they have observed that there is a good response from the person who are diabetic in case of glycemia and various other diabetic cases. Now, apart from diabetes, cancer has the major problem. Even though we have a good treatment for the cancer now, we can save people from the cancer. What play very important role in cancer, or in the diet of cancer patient, is minerals. How? Let's see. There are various studies which supports that yes, minerals can give good amount of minerals in the body, can give good support in the treatment of cancer. What is cancer? Cancer is a condition where the cell in a specific part of the body grow or reproduce uncontrollably. The cancerous cells can invade and destroy surrounding healthy issues, including organs. Cancer sometimes begin in one part of the body before spreading to other areas. There are over 200 different types of cancer, each with own methods of diagnosis and treatment. So cancer doesn't matter how much we develop, cancer also develops like our COVID. Okay, so cancer, like this picture shows various other major types of cancer: leukemia, lymphomas, colon cancer, bladder cancer, so many breast cancers, lung cancer, then fat, bone related cancer, then muscle related cancer. So there are more than 200 different types of cancer. So there are few evidences which says that micronutrients can be micronutrients, especially minerals, can give a good effect, or good amount of minerals can give good effect in saving the cancer or in the treatment of cancer. The field of investigation of the role of nutrition in the cancer process is very broad. We overlook this, but yes, there are few hospitals in India who are actually working on nutrition and cancer. They believe that 30 to 40% of the cancer, and not only Indians. American Institutes of Cancer Research, World Cancer Fund, they believe, they have stated that 30 to 40% of all the cancer can be prevented by appropriate diet, physical activity, and maintenance of appropriate body weight. So here cancer minerals play a very important role, and it is likely to be higher than this for some individual cancers. It can be higher even especially in case of some individual cancers like stomach cancer. Stomach cancer in such cases, or intestinal cancer, or cancer which occur in jejunum or duodenum. Such cancers, even liver cancer, such cancer can be prevented, or if it is found or identified or diagnosed at very early stage, it can be treated with drug and good nutrient as well. So in the treatment of cancer, selenium plays a very important role. Selenium is a mineral with anti-cancerous properties. Many studies in past several years have shown that selenium is a potent productive. नहीं चाहिए, thank you. So many studies in last several years have shown that selenium is potent protective nutrient for some forms of cancer. Okay, and selenium, how basically it acts: selenium is present in the active site of the many enzymes, including thyrodoxin reductase, which catalyzes the oxidation reduction reaction, and these reactions may encourage encourage anti-cancer cells to under apoptosis. And apart from that, means they basically, what they do, catch selenium with many enzymes, including thyrodoxin reductase. They catalyzes the oxidation reduction reaction, or because of this catalyzation of biochemical reaction takes place inside the body, which hinders the cancerous cells to go for further multiplication. Then selenium is a component of antioxidant enzyme. As I was discussing in earlier slide, selenium acts as antioxidants also. So they which antioxidant enzyme? Glutathione peroxidase, which also acts as a anti-cancerous agent. Selenium improved by the immune system ability to respond to the infections. Okay, selenium also helps in improving our immune system, because of which anyone who is a cancer patient, they are having vulnerability to catch infections very fastly, or they definitely visit hospitals and hospitals again and again. There they can catch hospital induced infections. So if such people are there on goods, they are consuming good good amount of selenium from food source, from supplements, or or in the form of drug, definitely this mineral is going to help them in for the better treatment. Selenium causes formation of natural killer cells. Enzymes in the liver may be induced by selenium, leading to the detoxification of some carcinogenic molecule. Selenium also helps also inhibits the prostaglandins that cause inflammation. Selenium enhances male fertility by increased sperm motility. Selenium can decrease the rate of tumor growth. This is what I discussed in a previous point, that selenium is having the property and the power due to which it can decrease the rate of tumor growth also. Now there are various studies, these are the examples, consider it as examples. There are various studies done at various places which shows that yes, selenium played a very important role in the management of prostate cancer. These are the list of this is the list of few food groups where it shows that selenium ranges from this to this. So if we can see marine fish and marine will have highest amount of selenium. Meat and meat product followed by meat and meat product. Pulses, it's not necessary that only a non-vegetarian people can have a good amount of selenium. Pulses are also rich in selenium. Dairy products are also rich. Our cereals and cereal products are rich. Then fruits and vegetables are also good source of selenium. Overall, it appears that poor selenium levels, especially in men, are cancer risk. If anybody is having deficiency of selenium, especially men, they are at high risk for the cancer. If the person has low selenium levels and other antioxidant deficiencies are also low, the cancer risk is increased even further. So if initial days it is low, or antioxidant defenses are any other antioxidant defenses like vitamin E is low, definitely they will be at risk in future. And more importantly, or magically, women do not appear to be sensitive to selenium, as breast cancer has not found to be influenced by selenium status. That's why there are few cancer. There are various types of cancer, but out of which there are few cancer which is highly influenced or which can be managed by good amount of selenium. Although both men and women were found to be protected by higher level of selenium from colon cancer and lung cancer, which is very important. Colon cancer, apart from all the women, in women we are there is a huge spike in colon cancer as well, and because of which apart from the breast cancer there is a huge spike in colon cancer also. So selenium can be a good option. There are good source of selenium. Good amount of selenium consumption can reduce the or can reduce the risk of cancer. Good vegetarian source of selenium are whole grains, legumes, which we have already discussed. Then coming to the minerals in kidney diseases. Yes, apart from cancer or diabetes, kidney diseases are also highly prone, or kidney diseases are also too much or highly abundantly found in our country. So that is also a major concern. So, what is kidney disease or chronic renal failure? Is a common clinical syndrome characterized by decline in glomerular filtration, perturbation of extracellular fluid volume, electrolytes and acid-base homeostasis, and the retention of nitrogenous waste from the protein catabolism. CRF is often a complications of sepsis, a trauma, or multiple organ failure, and primary event leading to the renal failure is a free radical medicated injury to the endothelial cells in the outer medulla. So because of kidney, because now this was the introduction of what actually happens in the kidney. Most of the time it happens because of sepsis, infection, or trauma. Sometimes it can be any kind of trauma. Sometimes just because of current, that electricity current, person may lost kidneys. So or multiple organ failure because of deficiency or some metabolic disorder or some autoimmune disease, kidney renal failure can be seen. So there are few studies which supports that selenium, zinc, copper, magnesium, aluminium can be helpful, or they in the form of food, or they in the form of supplement, or they as a drug can help in the treatment of diseases like chronic renal failures. So these are material and method. I'm not going deeper here, but serum elements, yeah, this is a little interesting. Let's see. So what happened, patients, what scientists have done, they basically did, they have taken the, they have taken study, or they have done a study which on the patients who were already admitted, okay, who were admitted to the nephrology unit of their, they were attending the OPD in the nephrology department. They have taken 55 hemodialysis patients of both the genders in ranging from 40 to 65 years, and then they have taken the blood samples. After taking the blood samples before dialysis and after dialysis, so they've taken two different groups, and one group they were taking the blood samples before dialysis, and then they were taking the blood samples after dialysis, and then diagnosis was done on their history, and then clinical examination. So 7 healthy subjects also they have taken for the control group. After that, from their blood, they traced selenium, zinc, magnesium, and various other magnesium, aluminum, etc., using absorption spectrophotometer. So what happened? Serum trace element were in some patients, like if we can see selenium, okay, pre-dialysis group was having less selenium, whereas post-dialysis group were having more selenium. Although they might not be statistically correct, or they might not be helping a lot, but like this magnesium, that was not significant. Okay, statistically they were not significant, although these minerals and their levels inside the body, they helps in the treatment of chronic kidney failure. Let's come to the one by one, all the 6. Like selenium, the control was having 9.5, then pre-dialysis was having 88, whereas post-dialysis was having 89. So let's see the comment what they gave. The comment given by the scientist was like, selenium, it is a part of glutathione peroxidase in the cytosol and the mitochondria, which protects the biomembranes against the destruction. And this is the reason after post dialysis they protect the membranes against the destruction. And selenium also a central enzyme for eliminating oxygen free radicals and peroxidases from the body. So this is how selenium helps. They eliminate all the free radicals from the body. They protects the biomembranes against any kind of destruction. Apart from then, zinc in renal failure, patients have disturbances in acid base balance, or the blood pH is or if their blood pH is acidic, low level of zinc was believed, or they believed that low level of zinc was the reason. So if there is a low level of zinc, definitely it is going to create more problems, or it is going to make the case more complex. So low level of zinc also creates problem in treatment of chronic kidney diseases. Apart from copper also play a very important role in maintaining the kidney health. Magnesium also, which are very rich in, they are abundantly or nicely found in liver and kidney, and their good levels also helps in the protection of kidney as well as liver. Aluminium in hemodialysis patient, accumulation of aluminium has been reported. So those patients who were actually having hemodialysis, there were more aluminium. So it's not necessary that all the elements, or sorry, all the mineral is going to, or their good amount in the body is going to help in the protection of the any organ. Sometimes their higher levels are definitely creating problem to the patient, as well as they are main reason for the slow recovery. So aluminium if it was found to be higher in the pre-dialysis stage, whereas it was found to be lower after the dialysis, which is a good sign. Coming to the cardiovascular health, yes, minerals are also very much important in cardiovascular health. Cardiovascular health, we all are acquainted, we all are very much known with this. Arterial hypertension, or and cigarette smoking, or elevated cholesterol level, any such bad activity or sedentary lifestyle can lead to coronary heart disease. There, if we will see the World Health Report, or any other report from any other country, there are huge large number of people who die every year from due to cardiac arrest or any other cardiac issues. So important these uh, how important these minerals are in the maintenance of heart. So calcium and magnesium, they play a very important role. They are the main element that gives water its hardness. And one thing, there are various researches which is being conducted nowadays. We are having a habit of having soft water. Okay, all most of us nowadays, we are consuming the RO water. And RO water is not rich in any kind of minerals. Normal hard water, river water or running water, which natural water, they are naturally rich in calcium, magnesium, copper, and this is what they make it hard. And hardness of water, it has been seen that yes, hard water prevents people from getting cardiac arrest. Apart from that, there are various other reasons also, but yes, many people, and in last few years, there is a village in Karnataka where most of the people were getting lung cancer. And in lung cancer, they felt that just because their water is very hard, and because of that, and there was research going on, because every other family of that particular village was getting lung cancer. So doctors were very much worried, and the local doctors, they conducted a research, and then they realized that initially their interpretation was just because of hard water, most of them are getting lung cancer. But later on, they realized that no, this is hard water. And then they stopped having hard water, and government established some RO filters for them. What happened? Lung cancer was not controlled, but due to the weak immunity, due to the low immunity, or due to highly or good prone conditions to be cancerous, they started having heart issues also. Then again, some doctors, they started some researches, and they found that yes, then there they found that no, hard water is not bad for the uh, heart problem, as well as they are hard water was not the issue which was causing lung cancer. There were another food staple, the food they were consuming, that food is uh, I'm forgetting the name of the food. That is the staple food of that particular village. Whole village consumes that. Mm, I think if I'll get back to you about that. So basically, hard water we have stopped consuming in day-to-day life, but they helps us. Hard water helps us in maintaining our heart healthy. So that is the one major thing that one should not stop. That's why nowadays that RO water we are getting, then they are refortifying those minerals. Now they are re-adding, once they are filtering all the minerals, and then they are re-adding it, so that one can, because now it is proved that hard water is highly good for the heart patients, or good for the good health of the heart. Lower intake of dietary magnesium, less than 186 mg per day, are associated with higher risk of coronary heart disease. Apart from that, higher magnesium intake may improve the cholesterol metabolism. So not only the lower intake, if we are taking good amount of magnesium, it will also maintain the cholesterol level inside the body. Okay, and And in most of the cases, drinking and cooking water may be of only minor importance to the trace mineral, trace element nutrition of individuals. In some cases, and particularly for the individual dependent on food and food system that do not provide adequate amount of calcium and copper, some water sources, by virtue of their hardness and contribution to the copper piping, can provide significant amount of those elements. So not only the calcium, copper is also important, magnesium is also important. These are, and these can be better, these things should be consumed from the diet to maintain our heart healthy. For any age group, it is not like those who are highly vulnerable to that any particular disease. No, any age group, if they are having hard water, or if they are having diet rich in calcium, if they are having diet rich in copper, or magnesium, selenium, definitely these are the nutrients, these are the micronutrients which are going to save us, or which are going to reduce many risks, like risk from cancer, risk from means risk of cancer can be reduced, risk of diabetes can be reduced, risk of chronic heart disease can be reduced, risk of kidney failure can be reduced. So it is high time for us to counsel, or it is high time for us to list out some good food groups, although they are abundantly present in natural food, locally available food. Still there are some points where we are missing and we are getting deficient in all these minerals, and because of which we are inviting any kind of metabolic disorder. Not only our lifestyle has changed, apart from that, due to lifestyle, we are very highly changing our food style also. And if we are changing our food style, we are limiting ourselves from many food which are rich in micronutrients, not only minerals, also vitamins. Coming to the vitamins, we know that their vitamins are categorized in two parts: water soluble vitamins and fat soluble vitamins. And vitamins play a very important role in all the metabolic activities of our body. Apart from that, they also act as antioxidants, and and they are, even after that, they are having a specific roles, like vitamin A is very much essential to prevent night blindness, vitamin C for the scurvy. So these are the very common aspects which comes under vitamins. But nowadays the most talked vitamin is vitamin D. Most talked vitamin is, and every other person, every out of every three, one person in the world, not in India, one person in the world is vitamin D deficient. Normally, if we see our health professionals, our doctors, our nurses, once they enter in the hospital at 9 a.m., there is no time to come out of the hospital. And majority of time they are under the roof. They are not getting chance to get sunlight. Most importantly, the major source of vitamin D is sunlight. Not only these people, there are various other now, like in why after COVID, more and more people are vitamin D deficient, because most of the time we spent our most time, or most of the time we spent under the roof. Means we were under the roof so many days, for so many days we did not go outside, and then few minutes of coming and going and walking till some nearby shop will definitely not going to give a approx amount of required vitamin D to our body. There are several vitamins have been demonstrated to interfere with pathogenesis of some metabolic disease, and mainly diseases mainly by three different mechanisms. So this is the light example, sorry, introduction of vitamin. So what maybe because of my vitamin malabsorption, there can be some eruptions of metabolic disease, or there are chances that there is error in vitamin metabolism itself, or there are some vitamin dependent syndromes. Later, due to the deficiency of apoenzyme, whose coenzyme is vitamin itself, can also be a factor which can lead to any kind of disorder. In case of pharmacological, instead of nutritional doses of the vitamin may be needed. It means that it's not necessary that only better absorption of vitamin will occur through the pharmacological aspect, means through tablets or through capsules or through syrups. We should think about the nutritional doses, means through diet vitamin are needed. It's not like maybe needed, they are definitely needed. Even though person is on vitamin supplements, we as a nutritionist, we ask them to consume good, or we design their food which should be rich in vitamins and minerals. So vitamins which interfere with inborn metabolic errors, or for each vitamin, the corresponding disease which may be treated are thiamine. Thiamine is the vitamin which helps in leucinosis, then nicotinic acid, which helps in hyperlipoproteinemia, biotin. Biotin nowadays, if we see that not only any disease, biotin is highly required for our maintenance of hair growth and then skin and so on. The biotin is in market nowadays. And then pyridoxine, pyridoxine, especially infantile convulsions, they can be used for their treatment, and then a few others including vitamin D. What happens, these are sometimes, because of their deficiency, these disease may erupt, or they are the only treatment, like folic acid, congenital folic acid issues, though especially where the marriages happens in the same sisterhood, brotherhood, and if they are having the same gene, similar gene, such places congenital diseases are highly prevailing, especially in most part of many parts of South India. It is highly prevalent. So there folic acid play a very important role in prevention of any such issues. Coming to vitamin D, the main vitamin which I'll be focusing here today. So vitamin D status in India, as I have said, all across the world, only out of every 3%, 1% is deficient in vitamin D. It has been a general belief that rickets and vitamin D deficiency are uncommon problem in India because of abundant sunshine, and now increasing evidence that is not true. Yes, it is not true. There is high there is a very great number of people in India who are vitamin D deficient. All the centers around a new emerging globe threat called vitamin D deficiency, which is not merely rickets or osteomalacia, but a huge hidden problem now being unraveled and reaching an epidemic proportion both in the developed and developing world. The problem has increased to an alarming proportion after new definition of vitamin D levels and its impact on bone health. So earlier we were the one who were thinking that, okay, vitamin deficiency can lead to most probably rickets or some other few small little problems. But slowly after, as we are developing, slowly this problem starts emerging, and now this is not limited only to the bone, or it is not limited only to the few little things. Now they are the major, vitamin D deficiency is a major cause of various other problems occurring in the body. WHO expert consultation stated that in most locations around the world, vitamin D can be synthesized in our body from mm, uh, by just giving 30 minutes in a day. Means as per WHO, they say that if we are giving 30 minutes in a day, complete exposure of our skin to the sunlight, then there are chances that we can maintain a good vitamin D levels. If we see the zenith angle, zenith angle is an angle of sun which gives a particular vertical rays to the earth. So as per the zenith angle of Indian time, zenith angle is calculated with the how much the place is far from the equator. So zenith, as per the zenith angle of India in the map of world, if person is standing in a sunlight from 10 a.m. to 1 p.m., means in between 10 a.m. to 1 p.m., for 30 minutes in a sleeveless cloth and half pant, that person means good exposure of skin to the sunlight, that person will remain healthy for very longer period. So one have to either from 10 o'clock, not from the 9 o'clock, as per the geographical condition of India. It is said that if anyone who is standing in sunlight in between 10 a.m. to 1 p.m. For 30 minutes, they will have a good amount of vitamin D, or they will not be the deficit. That is the best time. What happens as the zenith angle changes, the radiation of the sunlight also changes, and it totally depends then when good radiation, good wavelength, ultraviolet spectrum of wavelength, good wavelength is coming to the skin, or good wavelength will help in better absorption of vitamin D. That will be helping us in the better absorption of vitamin D in skin. So that 10 p.m. to 1 p.m. 10 a.m. to 1 p.m. time is very much important for any Indian. Doesn't matter South India, North India, East India, any part of the India, anyone, if somebody is there, one should, for the healthy lifestyle, one should go and stand in sunlight for at least 20 to 30 minutes. 30 minutes is a maximum time given by WHO, but as per Indians are and as per the zenith angle of that duration is said to be the best time where one can, if they're standing for 20 minutes, that is enough person, and just standing there for 20 minutes, we can delay, we can even eliminate the risk of osteomalacia, osteoporosis, any and many other long run or high risk metabolic disorders, uh, by maintaining the vitamin D inside the body. Let's see vitamin D status in pregnant women and their newborn. Some studies from the northern India have shown that vitamin D deficiency less than 20 nanogram per ml in the pregnant women on their newborn. One of the studies has shown that pregnant women in winter had higher uh, vitamin D levels than in summer. Studies from the South India, Tirupati have also shown the similar trend. Mean to say that, especially why there was a more vitamin D in the winter. There was more vitamin D in winters because it is trend in North India that they will go and sit anyhow just because of if there is a sunlight, they'll go and sit in winters. But in summers, most of the women, especially women, men, due to some work, they will definitely go out and have the good amount of and can have good amount of vitamin D. But in case of women, they do not come outside the body, outside the house. So it is very easy that one can be deficient. What happens when the mother is deficient? If mother was deficient, toddlers have shown to low vitamin D levels. So as mother were deficient, now toddlers are also deficient because of uh, low vitamin D. And then if they are deficient, then definitely their consumption will be less. They will be, and toddlers, they'll not feel, if even though they'll feel, they don't know how to react, they are not capable of to speak also. So that deficiency is hidden. Okay, so such things will lead to the deficiency in young or newborn also. That's why earlier we had a good practice of doing massage, giving massage to the young children for 20-30 minutes in every home. That was the tradition all across the all. Now also tradition occurs, but earlier people used to sit in the sunlight. They used to have a good amount of they used to give good amount of time in the sunlight, so there was no deficiency in young ones. But now it is highly prevalent. Mother is busy, parents are there, they're not living with the grandchildren, and these are the various factors which affects the lower, which invites the lower level of vitamin D status in pregnant women. Coming to the vitamin D status in children and adolescents, or vitamin D status in middle age group. So yes, in adolescent young, those who are now attached to their laptops, those who are more attached to their desktops or mobiles, they are deficient in vitamin D. And if they are deficient in vitamin D, definitely they'll be deficient in calcium as well, because vitamin D highly responsible for the proper metabolism of calcium inside the body. Same thing happens with the age group which is too much busy in building the career. They'll not have even 20 minutes to stand in the sunlight. So such things are there. Means these are the things which says that they are at risk. They are vitamin D deficient. Whereas if vice versa, there are people and the people who are having longer exposure to the sunlight, like those who work in the fields, or are militaries or the paramilitary, or they were having a good amount of calcium, also they had higher vitamin D status. So those who are having the field job, definitely they are rich in, or they had a good status of vitamin D as well as calcium. What one can do to maintain the vitamin D? Exposure to the sunlight for at least 30 minutes per day, good dietary calcium intake equivalent to 1 liter of milk and milk products, not only milk, any kind of millets can help in maintaining good calcium inside our body. Then artificial fortification of infant food products. Apart from that, some supplements, artificially fortified foods can be consumed. And considering the huge cost involved, it would be wise to advocate direct. Yes, supplements are always costly, and fortification method is costly. Fortification technology is really good, but definitely it is costly than being in a sunlight for just 30 minutes. Other than that, fortified foods are a good source, and that can be supplemented, that can be given to pregnant women, lactating mother, even very young children, so that one can maintain vitamin D levels in India. Now, apart from vitamin D, there is one of the major concern, and that we say as any deficiency of micronutrient now, that is hidden hunger. Deficiency of micronutrients are known as hidden hunger. What happens? India ranks 97th. India ranks 97th, although it's an old report, but we have not reached much. That doesn't mean that 97th is a poor number. Out of 118, 97th rank means the one who got the first rank was the most hungry country. So India is not in that bad condition, but if we will look as per our states, as per the number of people who are, as we are a huge country, yes, hidden hunger prevails widely. Okay, so let's see some data. Almost 48% of the children under the 5 years are stunted, 60% are anemic, 70% consume less than 50% of the dietary recommended micronutrients. So definitely they will lead to hidden hunger. What constitutes micronutrient deficiency? Micronutrient deficiency, also known as hidden hunger, refers to inadequate intake of crucial vitamins and minerals such as zinc, vitamin A, folate, and needed for the health, which are highly needed for healthy mental and physical growth of children. What are its effects? What happens if there is a deficiency? We all know very well, stunting in a children, weakened immune system, impaired cognitive function, anemia, low energy levels. These are the problems. And that will lead slowly. So we'll not come to know that yes, the person is hungry. Okay, there are physical examination in case of macronutrients where malnutrition will occur. There are some due to as we can identify that yes, the person is a person, a child is malnourished. But why do we say it hidden hunger? Because micronutrient deficiency does not give that severe symptom. Okay, or physically you may not perceive any major changes inside the body. And but in a long run, definitely it can lead to various diseases. What are the solution? Variety of cereals, legumes, pulses, animal food source, fortified foods, drinks with micronutrients. Biofortification, one of the important uh, terminology nowadays we use. Biofortification, yes, it can be an antidote for the hidden hunger problems. What is biofortification? Biofortification, an agriculture-based approach to the development and dissemination of micronutrient-rich crops, offers a viable option to mitigate malnutrition and hidden hunger. So what basically agriculture scientists are doing nowadays, they are trying to modify the genetically modify the plant in such a way that plant can give a good amount of iron, plant can give a good amount of calcium. So if plant itself is giving a good rich source of fruit, even though after processing, and just because it is biofortified, not the fortified during the processing of the food, definitely that will be cost effective, as well as then we need not a separate industry or separate unit for the biofortification and for the fortification. Okay, and this will also reduce biofortification is cost effective in comparison to generalized fortification technology which we do during the food processing. So if biofortification is done properly, and then scientists are getting results as well, they are able to now grow iron rich crops. Apart from iron rich crop, magnesium rich crop, selenium rich crop, they do add some microorganisms in the form of fertilizers, and these are the fertilizers. Microorganism will have more calcium or will have more iron, which will help, and that kind of biofortifications agriculture scientists are actually working upon, and then there are results. Unlike food supplements such as micronutrient rich capsules or the food products fortified during the processing appear to be the fastest solution options, which demands considerable time, resources. Biofortification is a simple and economical. This is what I said, that yes, we need to establish for food supplements or doing fortification in foods. What happens, we need to have micronutrients from somewhere. Okay, and then we are extracting the micronutrient and then incorporating in some food product. Instead of that, if we are going for the biofortification, definitely it is going to be a boon for micronutrient deficiencies or to eliminate hidden hunger. It mainly targets poor and rural households where home production and the consumption of staple food crops is significant, and the consumption is marketed surplus is most likely to remain within the community. Yes, what happens, although any government or any food scientist society, they always try to fortify nutrient in the staple food, like how iodine is being fortified in the salt, and then not only iron, vitamin A is being fortified in a wheat flour, and there are various other countries where governments sell these products with the fortified one only. Like in our country, iodine is one mineral which is being sold all the time in a fortification mode. Like we say in Hindi, it is like if there is a sign of signing sun on the packet of any kind of salt, that means that sign, that picture shows that there is a fortification of fortification of iodine in that particular salt. Okay, so if we do biofortification, if we are successful in the biofortification, definitely it's going to be a boon for the society for whom the fortification or post harvest post-harvested fortified products are expensive for them. So biofortification will be a better option. Enriching the staple crops with required micronutrients reduces the people's nutritional vulnerability, because during the economic shock or the poor tend to reduce their consumption of higher value foods, commodities that are naturally rich in micronutrients. With one-time research and development investment, biofortified seeds could spread through the existing seed distribution system. So that can be done if, obviously, if biofortified seeds are there, we will never be deficient in at least in micro minerals. So government have also taken many initiatives like Pradhan Mantri Matru Vandana Yojana, maternity benefit program, then Poshan Abhiyan, National Nutrition Mission, and other schemes like Integrated Child Development Services, which is prevailing since very long, midday meal, and National Food Security Act are well mentioned and have been able to provide good food to the people to survive. However, in the recent Global Hunger Index ranking has reminded us that this is the need of our to talk about hidden hunger, and then thus biofortification can be a better option. If scientists, although we are getting good results, but yes, there is always one problem, that is acceptance by the society. Like how we have developed GM modified food, but scientists have developed GM modified food, but there is no acceptance in Indian society. There are many countries, South African countries, who are abundantly or very nicely they are consuming GM modified food, but we as a in our Indian society, GM modified foods are not acceptable. So again, that can be a issue. Right now, we scientists are only doing that. Successful biofortification could be done in which product, various other food products or various other staple foods they are trying to biofortify, but it is another problem will be coming is the acceptance of that biofortified seeds or biofortified food products. That's it. In conclusion, yes, not only macro minerals, micro minerals are equally important. Macro minerals deficiency is called as hidden hunger, where it is very difficult to find out who is deficient or who is not until unless we go for biochemical analysis. Apart from that, calcium play a very important role, just because calcium are the total of 50% of the total minerals present in our body, and with calcium, and not only calcium, every other mineral need help of another mineral. Every other vitamin need help of another enzyme, and that is also associated with the same vitamin. So that's why we need to have more focus on, along with macronutrients, also on the micronutrient management in diet. This is all from my side. Now I'll welcome you all for some questions. Roshan, Dr. Roshan, are you there?
Yes, Suti, I'm here. Yeah.
Fine.
Am I audible, Suti?
Yes, you are audible.
Yes, yes, yes. If any participant is having any question, please have in the chat box. I think Suti, you can wait for 4 or 5 minutes.
Okay. Can I stop sharing?
Yeah, you can stop sharing your presentation. Yeah.
Fine. Thank you.
If any participant is having any query, please post in the chat box. I think we have some questions, Suti.
It's not like that all the vegetarians would
In the
see.
chat box, please see the chat box. I think
Yes,
somebody
I
have
saw the
asked.
question. I saw the question.
Yeah, yeah.
Hmm. So I'd like to tell you here that we, it's not necessary, it's not compulsory that all the nutrients or all the minerals are only rich in non-vegetarian food. We do have vegetarian food. If you are having the book of food book, which is being published by National Institute of Nutrition, and then sponsored by ICMR, if you go and see the nutrient level in the vegetarian product, they are huge. Yes, there are chances that there may be a loss of nutrients during the processing. So for to reduce that loss, we can minimize the processing, or we can use some old methods of processing. Old mean to say traditional methods of processing of that particular food, or we can consume the food in a raw form. It is, if it is consumable in the raw form. Or one more thing, that how cooking methods also play a very important role. So even though if few vegetarian products are rich, there are chances that they may be in the lower the quantity in comparison to the non-vegetarian food products. There are chances that they may be lower, but we can double the consumption amount, we can reduce the processing, we can do the like how vitamin C increases after the germination. Once we do sprouting, of any food like moong bean or chana or even wheat, if or ragi, if we are doing if we are sprouting it, germinating it, what happens? They develop more vitamin C after germination. So we can opt such practices to increase the quantity of minerals or micronutrients. We should opt a better cooking method for the particular food crop. Okay, what happens? Yes, there are like vitamins, water soluble vitamins. People are having practice, many people. I'm not pointing it over anyone, but I'm telling you that there are many people who will having the practice, they'll cut the vegetable and keep it in a water. Will water soluble vitamins survive? Definitely they'll leach out. These are the malpractices, small malpractices we do at our home. Just to get or enhance the more and more flavor and taste, what do? We add many combinations of spices and condiments. We do not stick to one. Your body will get confused from which nutrition we should take, from which food we should take what nutrition. There should be, that's why boiled method is the best method, or somewhere like we can stop leaching out of the nutrient. Not to, we should cook the food product. Instead of cooking, we just burn, we just to get the heavy flavor. And such can, I being a nutritionist, I never say that one should not completely or one should completely avoid such kind of food, but we can maintain a balance in the sense, morning we can maintain that, yes, morning we will have a micronutrient rich products, like sprouts and salads and fruits to maintain vitamins as well. And then after morning lunch you can have some other things, and then again evening you need to supplement your body with some vegetarian source. So yes, vegetarian sources are, I accept that they may be lesser in quantity. We can double the quantity. We can change the food processing methods. We can opt a better cooking method for better metabolism of that particular, any particular nutrient inside our body. I hope my answer is justifiable. If any further question is there, you can ask. Why white hair occurs in a young age? There are various factors. First thing, yes, it is a vitamin deficiency, sorry, micronutrient deficiency, not only micronutrient deficiency, here are proteinic in nature. There must be some imbalance with the protein and micronutrients, means imbalance between macro and micronutrients. Apart from that, have you, if you have observed our food pattern in last 50 years, obviously none of us will be of that age, but means if you talk to the people who are older, they definitely say earlier we were used to it, we do used to eat such things. Nowadays, from where we are getting iron? Of course not. If you see the old book of ICMR, that food composition table book, you will see that poha, avlaki, what we say in South India. So avlaki was one of the richest source of iron, but now avlaki is not the richest source of iron. Why? Because earlier the pressing machine which we were using for preparation of avlaki was made from those iron rollers. But now because of modern technology, there are no more iron rollers, they are steel, or any other means any other compounds, elements. So definitely iron is not transferring into the avlaki, then it will be deficient. Similarly, there are various other, like earlier what the oats was prepared, that was differently prepared. That there also, for the preparation of oats also, there was iron machine was there. But now we have developed technology, finer quality. Now we are more attracted towards the finer things which looks good at camera, that kind of. So such changes in pattern for the longer period of time has given impact on bad quality of nails, bad early graying of hair, and various other. So absorption, vitamin, lack of vitamin D inside the body, low blood circulation, these are the factors which are responsible for low early or young graying of hairs at young age. Any other question? I hope you are satisfied with the answer.
Any participant with any other question, please post your question in the chat box.
Okay, Roshan, can we end the meeting? I have
Yeah, I
another
think
meeting.
all the participants are satisfied. Then, yeah, thank you so much, Suti, for wonderful presentation. The topic was today's presentation was really interesting, and thank you so much.
Thank you, Roshan. Thank you for the opportunity to all the NIFTEM team as well as Kerala government for giving such a good training to all the participants as well as we too learn. Thank you.
Thank you. Thank you so much.
Thank you.